Hey everyone, let's talk more about Lyftogt Prolotherapy, the basic principles and mechanisms of how it works. So Lyftogt Prolotherapy operates on the principle that chronic pain often originates from the nerve endings located just under the skin, known as our nociceptors. When these nociceptors are inflamed, they send pain signals to the brain, for which we then experience as pain. The basic mechanism of Lyftogt Prolotherapy involves injecting a solution of dextrose at 5% into the areas around the inflamed nociceptors. This creates a hyperosmolar environment that draws fluid out of the inflamed nerves, reducing swelling and inflammation. As a result, the pain signals sent to the brain are down-regulated, resulting in relief from chronic pain. Now, the three main principles at play here are a reduction of inflammation, which as that water is drawn out of the inflamed nerve tissue, the swelling and inflammation are reduced. Now this helps to quiet the nociceptors, reducing their ability to send pain signals to the brain. The next one is about stimulating healing. The dextrose solution also stimulates the body's natural healing mechanisms. It does this by attracting growth factors to the area, which help to repair damaged tissues. Now this can result in long-term healing of the underlying issue causing the pain. And then we're talking about long-term pain relief. With repeated treatments, it can provide long-term relief from chronic pain by targeting the root cause of the pain rather than just masking the symptoms. It offers a more effective solution for many patients. Now, one proposed mechanism of action suggests that the dextrose binds to presynaptic calcium channels and inhibits the release of substance P and CGRP, which is our calcitonin gene-related peptide. Now, thereby it is going to decrease that neurogenic inflammation, so the swelling around that nerve. But at the same time, this allows normal flow of nerve growth factor and subsequent nerve repair and decreased pain. You can start to see how this works. Now we're looking at this image as well, where we're seeing this chronic constriction injury, the substance P coming through, and that calcitonin gene-related peptide as well. Now the fascial penetration point can impact a nerve in two significant ways. Firstly, the trauma to the nerve can result in edema or swelling that travels both proximal, up, and distal, down from the injury site. When this edema reaches the fascial penetration points, it can constrict or tighten around the nerve, impeding its function and reducing the flow of nerve growth factors. Now, Morton's neuroma in the forefoot is an example of this phenomenon. Additionally, changes in that fascial tension and tightness caused by repetitive muscle, tendon, or joint dysfunction can also create a compression point for the nerve. Another essential concept in neuroprolotherapy, which Lyftogt Prolotherapy is known as a bystander disease. This concept explains how issues with superficial nerves can affect deeper anatomical structures. Hilton's law states that a joint tends to be innervated by a branch of a motor nerve, which also supplies a muscle extending and acting across the joint. Another branch of the nerve often supplies the overlying skin. And this is why we get that high hypersensitivity locally in that area and sometimes referring locally around that area as well. Now, hopefully this has given you a little bit more information with regards to the basic principles and mechanisms of Lyftogt Prolotherapy. Keep having a look at some of these further videos and see what else we can learn together. Cheers.